So a few people have asked me, what exactly are you doing in this fellowship? What is Mohs surgery? And despite how it sounds, it's not about molds or molds on the skin. Mohs micrographic surgery is a specialized way of removing certain types of skin cancers like basal cell carcinomas and squamous cell carcinomas. It was developed back in the 1930s by this guy called Dr. Frederick Mohs, hence the name. And honestly, it's one of the most precise techniques we have in treating skin cancers. Here's how it works. Instead of taking a big chunk of skin around the lesion, sending it off to the laboratory for the pathologist to tell us if we got it all cleared, which can take sometimes a couple weeks. With Mohs, we can do everything on the same day. With Mohs surgery, we remove the entire lesion with a very thin margin, map it, process it, and then check it under the microscope all in one day. And if there's any skin cancer left, we will know exactly where to go back to and take a further layer around the affected area. And so we'll repeat it until the skin cancer is completely gone. How cool is that? The good thing about Mohs is that it has the highest cure rates in treating certain types of skin cancers, around 99% for new skin cancers and around 95% for recurrent ones. And this is much higher than just standard surgery. And because we are only taking the skin cancer layer by layer, we tend to preserve as much normal skin as possible with Mohs compared to standard surgery. And this is particularly important in delicate areas like around the eyes, the nose, the mouth, and even the ears. Patients are often surprised to hear that this is done under local anesthetic, which is actually life-changing because it means that you don't feel any pain or sharpness during the procedure. Because we had to take time for tissue processing, analyzing the slides, it can take a few hours for the entire procedure to take place, and sometimes patients are asked to wait for the whole day. What we usually do is to prepare the patients in advance, saying that you may want to bring a person in, you might want to bring a book, a podcast, or anything that would occupy your time whilst you wait. And that's Mohs surgery in a nutshell. It's precise, tissue sparing, and the gold standard for skin cancer treatments.